concerns have also been raised around so-called false negative COVID-19 test results. Now, this is when people test negative for COVID-19 only to test positive a few days later. Experts are saying that laboratory tests on potential COVID-19 patients are sometimes carried out before the virus takes hold in a person's respiratory tract and therefore can go undetected. Researchers at Johns Hopkins University say the likelihood of testing negative for COVID-19 4 days after exposure to the virus is as high as 67%. So the question then becomes, when is the right time for one to get tested, and how sure can one be that in fact they're out of the so-called danger zone when in fact they test negative? Well, the seemingly shifting goalpost in coronavirus testing is the subject of our discussion now. And for more, we're joined by Professor Diana Hardie, and she's the head of the diagnostic virology laboratory at Cape Town's Groote Hospital. Prof, thanks very much for your time and welcome to the AM report. I imagine the immediate question is, when one receives a negative COVID-19 test, how confident can they be that they're in the clear, considering there's no telling when one would have contracted the virus to begin with?
Okay, so I think it depends on why, when you go, what the reason for having the test was in the first place. If one has had a contact with someone that is positive and you are still asymptomatic, but you've had a significant contact with that person, there's no point in having the test immediately, because there's a period of time before somebody is going to be having virus in the respiratory tract. So the incubation period of the infection is anything up to 14 days, but it's actually closer to about 5 days. So usually for the first 5 to 7 days, the person will still be feeling perfectly fine, and there's no point in testing at that point. The test becomes positive just before symptoms start developing. So that would be about the day before you first start developing the myalgia and the feeling unwell, and that is when the virus spikes and peaks in the respiratory tract, and that's the time that you have the highest likelihood of getting a positive result. After that, the virus, during the first week of that illness, the virus levels drop off gradually as your body develops an immune response to the virus. Right. So your highest chance of detecting virus is the first day that you're sick.
Right. And of course, the knee-jerk reaction is to go immediately for a test once you've learned that you've been in contact with someone who's actually contracted the virus. And if I'm understanding you correctly, that's actually a waste, because the outcome there is, in some instances, unlikely to be accurate.
In fact, it is going to be negative unless you had previously, unknown to you, been in contact with somebody who was positive, and so that you have already gone through your incubation period and you are in fact about to present. So the advice is that somebody who's had a significant contact, they should isolate themselves, because they don't know when they're going to get sick. We know that the average is it's on around about 5 days, but it could be less and it could be more. And so someone ought to be quarantining themselves for the duration, and when they become ill, that's the time to have the test.
You know, often we get the health minister or the health department giving us an idea of how many tests have been conducted, and we're getting a clearer picture of what that actually tells us. Do we have figures of how many false negatives we've received since the outbreak began, especially considering what I've just mentioned, you know, this widespread practice of going to test immediately after being in contact with someone who's tested positive?
Yeah, you see, that information is not captured anywhere. So we don't know how many people are having a wrong test. All we know is what comes into the laboratory and the proportion of them that come out as positive. Obviously, in more regulated areas like the healthcare environment, people know exactly when the right time to have a test is. One can't tell when it's outside of your control, we don't really know that information and it's not captured.
And I guess it does also, again, open up the conversation about testing for antibodies, which is, I know, where the conversation is sometimes headed once we start speaking about developing possible vaccines. Do you imagine a situation where perhaps the antibodies give us a clearer picture of the pandemic versus, being able to detect the virus in somebody else's system? Because as you, I think, have mentioned, the virus sometimes can go undetected after you've shown symptoms, so there's a period really where even if you have the virus in your body, you're still not able to see it once you've recovered from the symptoms. So is perhaps monitoring antibodies the way we should be going if we want to get a clearer picture of this outbreak?
Okay, so you're bringing in the alternative way of diagnosing this infection. So the gold standard test is the respiratory, the PCR test in the respiratory tract, because that identifies people when they are infectious and infected, and therefore those are it is at that stage of the disease of the infection that person is a danger to others, that can transmit infection to other people. Antibodies become positive later, usually only in the second or third week after symptoms develop. So they are no good for diagnosing infections in the acute stage, but they may be valuable, they may play a role in if somebody, for example, had symptoms but never got tested and want to, want to establish have they been infected or not. Then an antibody test could potentially play a role. But one of the other problems we currently have with antibody tests is that there are question marks on how reliable those tests are. They were in the early stages of the epidemic, tests were developed very rapidly, and many of those tests actually, the quality was very poor, and so you didn't get very good, reliable results from testing from them. And so the medical and scientific community are still very dubious about using serology in a diagnostic setting. The other thing is that we do not yet know whether people are going to be protected from reinfection down the line. And we don't want to give people a false sense of security. If they test themselves, they've got antibodies, they might think, okay, well, now I'm good to go, and I've had my disease. I'm no longer going to ever have to worry about being infected again. And we don't know that. In fact, we suspect that reinfections probably will happen, maybe not in the first few months after an infection, because there probably will be a degree of immunity, but later on, in years to come, people are probably going to be reinfected. And so there's also this worry that that using an antibody test, people will misinterpret what the result actually means. It may give evidence of exposure, but not necessarily immunity.
Absolutely. All very interesting. I imagine we'll continue learning as much as we are about this virus in the days, weeks, and possibly years to come. Let me thank you for your time for now. Certainly appreciate it. Dr. Diana Hardie is Head of Diagnostic Virology at Groote Schuur Hospital. Appreciate your time indeed.